Taiwan, a province of the Republic of China, is a small and mountainous island, 100 miles off the coast of mainland China. About 12.3 million people live within its 14,000 square miles. In just 30 years, 2 times as many people may have to share the living space on this small island. While the mortality rate has been brought down rapidly from 18 in 1947 to 6 in 1963, the birth rate has remained about the same, with a population increase at an average rate since 1947 of about 4% per year. Taiwan has a young population with over 45% in the consuming but unproductive age category below 15. The economic burden is severe. With a population reduction, there would be fewer consumers dividing the total production of Taiwan's industry, and thus an increase in the economic welfare of the consumer. However, the birth rate has been falling slowly since 1948, primarily because women in their early 30s with 3 to 5 children want to stop having more children. We know that married women 20 to 39 want fewer children, approve of family planning, and are trying ineffectively to limit the size of their families. About 90% of the wives surveyed approved of the idea of doing something to limit family size. For the most part, they wanted to know more about family planning methods. They realized that more of their children were surviving because of the public health program. Couples want to limit childbirth because they realize the burden of having children they cannot afford to properly feed, clothe, house, and educate. Provincial health authorities undertook to develop a program in 1962 to make a family planning service more readily available to the city of Taiwan. Financed by the Population Council of New York, the project was designed by Dr. Bernard Burroughs, the Population Council of Dr. Ronald Friedman, also publicized in the Scientific American. Here, Dr. T.C. Hsu, the Commissioner of Health, explains the application of the widely publicized Taichung project to the island-wide family planning program. Taichung City contains neighborhood units, each with 14 to 25 families. In certain neighborhoods, nothing was done. In others, only family planning literature was mailed. The rest of the neighborhoods were divided into areas where personal contact was made with the wives and both husbands and wives. Field workers made home visits to 1/5, 1/3, and 1/2 of the neighborhood units in 3 sections of Taichung City. Approaching 1/5 of the neighborhood units was about as effective as 1/3. Although reaching 1/2 showed a significant increase in response, the cost was not justified. It was decided that the workers should visit 1 out of every 5 neighborhoods at first. The mailings were rather ineffective. They did little better than nothing, but they were not directly keyed to the polyethylene intrauterine device, the most popular method. Visiting the husbands as well as the wives made little difference. Based on these findings, the field staff made home visits only to the wives. The impact of the program was not felt immediately nor at one time evenly. The first phase of the national program was to provide the polyethylene intrauterine device, or IUD, through private doctors. Since the IUD was preferred by over 75% of all the respondents, the National Family Planning Program trained 400 of the island's obstetricians and gynecologists to insert the plastic loop. The training of qualified doctors was done by Dr. L.P. Joe, Secretary of the Maternal and Child Health Association, and Dr. C.H. Lee, who has supervised the IUD research studies. At each county, the doctors are invited to attend an IUD insertion class by the county health director. The training lasts 1 day. Medical forms are explained, and the doctors are given coupons for case referral. The coupon is divided into 3 parts. The first part is kept by the person who refers the case. The second part is returned to the Population Study Center. The third part entitles the doctor to payment of 75 cents U.S. for each case. The patient also pays 75 cents, giving the doctor a total of $1.50 for each insertion. The medical phases of the program are explained by Dr. Lee. Dr. Lee explains the technique of insertion, contraindications, and what advice to give to the patients. All 4 loop sizes are manufactured in Taiwan. Number 3 is most often used. Dr. Lee demonstrates how the loop is inserted. It's first placed in a small plastic inserter. The inserter is placed into the uterus, upwards or downwards, depending on the position of the uterus, and rotated 90 degrees so that the loop lies on a frontal plane. The loop regains its original shape after the plunger pushes it into the uterus. The thread remains protruding through the cervix. To remove the loop, the 2 strings are grasped and it is easily pulled out. The doctors have many questions. What are the side effects of the loop? Most of the women wearing the loop will not have any serious side effects. Some will have minor intermenstrual bleeding for a short time. This can be expected and does not damage the woman's health. The loop is usually removed in cases where the bleeding continues for 2 weeks. Does the loop cause infection or cancer? Only 0.5% of the cases had infection during the Taichung study. The incident of infection cannot be attributed to the loop because it occurs in this percent of women without the loop. In studies conducted in Taichung, there is absolutely no connection between the occurrence of cancer and the IUD. The doctors practice inserting 1 or 2 loops. They are already familiar with the instruments and how they are used. The ideal time for the insertion of the loop is considered to be during menses to 7 days after menses. However, the loop can be inserted at any time. Once the doctors are trained to insert the loop, the public is informed about the loop and other methods of family planning by the doctors themselves, the health station personnel, village health education nurses, and full-time family planning workers. The full-time family planning workers are predominantly responsible for referring women to the doctors. Sitting here, we have Mrs. Lin. She has a high school education, is married, and has 3 children. She's pleased to see in the newspaper that there are job openings for family planning workers. She's familiar with the difficult problems faced by the mothers of Taiwan, having unwanted children that are not given the proper care. Mrs. Lin goes to the County Health Bureau. She has an interview with Mrs. Liu, the county nurse supervisor. Mrs. Lin has had experience in working with mothers as a home economist for the Farmers Association. Mrs. Liu believes that Mrs. Lin will make a good family planning worker. She's over 30, married, and willing to work hard. The training session lasts 2 weeks. During the first week, the workers are instructed in Taiwan's population problems, health organizations, health education, salesmanship, and public speaking skills. Here, Dr. Lee, the county health director, explains the Taichung Action Program and its application to the National Family Planning Program. Mrs. Liu explains the flyers, which are an inexpensive means of informing a large number of women about the loop in a short time and at little cost. The workers are given pelvic models, traditional supplies, audiovisual aids, and educational materials. Emphasis is given to the IUD. Mrs. Liu explains what is known about the average 100 women between the ages of 20 and 39. At any one time, about 14 will be practicing contraception to their satisfaction. About 15 will be sterilized or are believed sterile. Another 15 will be pregnant. This leaves only 56 women who might be interested in family planning. But 28 of these women will not yet have the number of children desired. Of the remaining 28, a full 24 will intend to use some method. If the field worker is successful in the first year, 11 will respond, 8 accepting the loop, 3 traditional supplies, which are available at the drugstores. Each worker will be working with a population of about 30,000. There will be about 5,400 households. And 3,300 women, 20 to 39. Only 1,650 of these women will have 3 or more children, one being a son. The job of gaining 11% response of the married women will result in 363 acceptances, the target for the first year. During the second week, the trainees learn how to use the audio-visual aids and educational materials. They are each given a $10 projector with film strips. The flip charts are the easiest to use. Traditional methods are also explained and demonstrated. Mrs. Lin practices inserting a foam tablet and filling an applicator with jelly. After the training, Mrs. Lin is ready to start work. Her first stop is at the Township Registration Office. Here she collects the names and addresses of all the married women, 20 to 39, with 3 or more children, one being a son. Because she can make about 1,650 home visits her first year, she plans to see all the married women with at least 3 children and one being a son. She starts on her home visits. Here she sees Mrs. Yu, who has 2 girls and a boy. Mrs. Yu wants to stop having more children so she can afford more for the children she has. Mrs. Lin explains with the use of a flip chart how a baby is born. She explains the anatomy of the sex organs in order that Mrs. Yu understands where the babies come from. Contraception is very simple. The male sperm is prevented from reaching the female egg by a barrier or contraceptive. Mrs. Yu is told that there is a method that will suit her. If she chooses a traditional method, it will be necessary for her to use it consistently and correctly. Mrs. Yu is told about the loop. Because it's easy to use, inexpensive, reliable, and safe, she believes that it is the method she would like. She finds it is made of a soft, flexible plastic. She's told where the doctor is located who is inserting the loops. She is given a specific appointment to go to the doctor at a specific time and place. Mrs. Lin also conducts group meetings. Today, she's arranged to talk with the teachers at a local school. She also contacts such organizations as the Farmers Association, women's clubs, servicemen's wives, factory and labor organization, or any other group which meets together with a common interest. She always talks in terms of the interest of the mothers at the meeting. The group meeting serves two main functions. They're educational, but more important, they help the women become aware that small families are socially acceptable. The women learn that many people in the community are already using means to have only the number of children desired. The information that is passed by word-of-mouth communication includes methods that are offered, usually the loop, and where they can be obtained. The women are encouraged to discuss with their husbands the methods they wish to use. News of the loop travels very quickly, especially if someone has a loop and can give favorable testimony. It was found in the Taiwan study that over 50% of the acceptors came without direct benefit of the program. Furthermore, removals decrease and reinsertions increase as the total number of acceptors in an area increases. Other direct information sources are the 100 village health education nurses. They're directed by Miss Laura Liu, Chief Health Education Section of the Provincial Health Department. The nurses are divided into teams. One team of 3 workers spends 1 month in a village. Each village has a population of about 2,000. During the first 2 weeks of their stay, they make home visits and conduct group meetings. The team teaches the families in the village about sanitation, fly control, and personal hygiene. The family planning effort is concentrated in the last 2 weeks of their stay. The village health education nurse has been responsible for referring about 6% of the total acceptances. The 220 family planning workers, like Mrs. Lin, have been responsible for referring about 1/3 of all loop cases. Here, Mrs. Lin is taking some cases to the doctors. The doctors themselves have referred about 1/3 of the acceptors from their own case load. The doctor checks for pregnancy, infection, tumor, and cancer. In Taiwan, very few women are not given a loop because of these contraindications. The loop insertion takes only a few minutes. The woman is told to return to doctor after 1 month, 6 months, and 1 year. However, most women do not return unless they have a complication. This woman is told to expect more bleeding during menstruation. For each case responding, a coupon is filled out and sent to the Population Study Center for evaluation. The Population Study Center is directed by Dr. L.P. Joe. The coupons are hand tabulated. Such factors as age, education, number of children who referred the case, and location are tabulated. The Population Study Center conducts an island-wide fertility survey, a follow-up sample of loop acceptors and coupon holders, and other studies which evaluate the national program. To supervise the workers, the administrative staff calls the family planning workers to the County Health Bureau for in-service training. In-service training is beneficial because it helps solve problems that come up in the field. Here, the director of the Kaohsiung Health Department introduces Dr. S.C. Hsu, chief of the Rural Health Division of the Joint Commission on Rural Reconstruction. The JCRR is a Sino-American organization which was set up after the war for the rural development of Taiwan. Dr. Hsu has been the dynamic leader of the family planning movement for the last 8 years. He is instructing the workers and answering their questions. The county health director introduces Mrs. Tessie Huang, who is in charge of the rural family planning workers. She's been responsible for the selection, training, and supervision of the family planning workers for over 5 years. The Population Consul's East Asia representative is Mr. S.M. Keeney, who has helped with the development of IUD programs in Taiwan, Turkey, Korea, India, Pakistan, Philippines, and Thailand. Here he is on a field trip to see how the work is progressing. He's had many years of experience of developing health programs while he was director of UNICEF in Asia. He asks the workers what does and doesn't work. Mr. Keeney and a grandmother talk about their grandchildren. She is all in favor of the loop, and all her daughters have one.
We hope that our expanding family planning program is helping in some way to accelerate this decrease in population growth. We, however, still have a long way to go to provide adequate means to plan family size for the 1.6 million married women of childbearing age whose present birth rate can double our population size in little more than 20 years.